Welcome back to So Much More, a women's health and wellbeing program. In the studio with me we have Chris Widdicombe, who is the maternal child health team leader at Greater Shepparton City Council with about 19 years maternal child and health nursing experience. Thank you very much, Chris, for coming in and speaking with us today.
No problems.
Excellent. What actually is a maternal and child health nurse? How is it different or similar to a midwife, and what sort of qualifications are needed?
So a maternal and child health nurse is a Division 1 registered nurse who also holds a midwifery qualification and who has also done some postgraduate study in the area of child, family and community health. So that's usually a graduate diploma or a master's level qualification. It's similar to midwifery in that both midwives and maternal and child health nurses need to have quite good knowledge of the antenatal period, the perinatal or birth period and the postnatal period. But then maternal and child health nurses also need to have a good understanding of children's health and development up to the age of 6 years.
How long would it take to actually study that?
It takes quite a while. General nursing now is a 3-year degree. You can do a combined nursing and midwifery degree, but I'd say probably most people still tend to do a nursing degree and then go back and get their midwifery qualification, which is another 12 months full-time, 2 years part-time. And then the grad dip for maternal and child health is another 2 years part-time after that. So it takes quite a while.
Are any of the workers that you are with specialised in particular areas?
Yes, you'll generally find that maternal and child health nurses have picked up some other qualifications along the way. So we have a staff member who's got a lactation-specific qualification. You might find that some maternal and child health nurses have got qualifications in areas like social work or family planning and sexual health. And we do have some staff who've done program-specific training, so for things like facilitating groups like Mother Goose or Circle of Security.
Do any of the workers there also do mental health first aid courses?
We've made sure that our whole team has done mental health first aid relative to women postnatally.
How many maternal child health centres are in the Greater Shepparton area?
We have 15 maternal and child health centres scattered across the municipality. Obviously, most of them are in Shepparton, and then there's 2 in Mooroopna, and then a number in smaller outlying areas. And we also have what we call an enhanced home visiting service, which is where nurses are based at council, but they provide the service to families purely by home visits. So for families who are finding it difficult to access a centre for whatever reason, or some of our more vulnerable families.
What services or tests are included?
So in terms of services, I guess our primary aim is probably to support parents in their parenting role by giving them timely advice that's current and evidence-based so that they have the information they need to be a good parent, basically. As well as that, we are continually monitoring and assessing their children's general health, so their physical health, their growth, their development, to make sure that that's all progressing as we would expect it to normally. Some of the support that we offer to families may be in the form of referrals. So if we're picking up something that's not progressing how we'd expect, that we'd be referring on to another professional to assess that. In terms of the tests that we carry out, we assess children's physical health and wellbeing at every visit that we see them. So we're looking at things like their skin health, their dental health. We check their hips and gait and things like that. And for the older children, we do a vision screen. For their developmental assessments, for the younger babies, that's built into the physical health assessment. And from 4 months, we start using a validated screening tool called the PEDS, which stands for Parental Evaluation of Developmental Status, which is really, it's a 10-item questionnaire that parents fill out, and we then discuss their responses with them. And then it's scored, and that gives us a pathway to follow. So if it's not a predictive concern relating to their development, we may just give them more information. If it is something that can predict a problem with development, then we'll be looking at things like having their GP assess them and possibly a paediatrician, or referring to other allied health professionals.
So do you test hearing as well?
Hearing is generally tested now by the audiologists at the hospital, fairly close to birth, and then if there are risk factors detected, we'll refer babies back for another assessment at about 8 months. We don't test their hearing as such, but we're looking for signs that there could be problems, and then we tend to refer to the audiologists for that.
With the hips, why do you test hips?
We test hips because there's a condition that can be either present at birth or develop as a child grows, whereby the hip joint doesn't form totally as we would expect it to. And it's one of those things where if we can pick it up early on, there's fairly manageable ways of ensuring that the hip joint does grow and develop normally, and that children are going to be able to move and walk and do all of those things normally. If it's not detected, then the hip joint doesn't develop as it should, and so babies, children, adults can have problems later on in life because of that and need surgery. So it's one of those things, they go into a little harness if it's picked up, and that holds their hips and legs in a certain position. It allows the hip joint to develop normally. If that's not done, then later on the management can be quite a bit more significant.
What age ranges are seen?
We see children from birth right up until they start school or are 6. But our program, the Key Age and Stage program, consists of a series of 10 visits that are spread from pretty much birth or about 1 week of age through to when children are about 3.5 to 4 is the last scheduled visit. So most of them are clustered when children are younger, because that's when there's a lot more happening for their parents and they need that support. So we see them at the first home visit, then at 2 weeks, 4 weeks, 8 weeks, 4 months, 8 months, 12 months, 18 months, 2, and then the 3.5 to 4 year visit. And outside that, we see them based on need. So if a parent thinks they need an appointment between those, they can ring up and make one. Or sometimes if there's something their nurse would like to check and see how it's going, she'll bring the parents back for a visit in between.
What happens if you miss a visit?
If you miss a visit, we generally just reschedule it. We try and make sure staff ring families if they've missed an appointment, because I think everybody's busy now and it's easy to do. So normally the nurse will ring in the next few days and just say, look, I had you booked in, would you like me to make another appointment? We do have an SMS system where if it's working properly, parents will get a text letting them know that they've missed an appointment so that they can ring our central admin booking number and rebook that.
What about the little books, the little baby book? What are they used for?
The little baby books still exist, but they don't look a lot like they used to. They've had quite a few changes, particularly over recent years. So the baby book is now a green plastic folder and has quite a bit of information in it. So it has information relating to the child's birth. We'll add comments based on our visits with families, so information about growth or general health. All of the PEDs that I talked about before are in the book, and we encourage it to be seen as the child's health record. So it's actually for the family to put information about their child in, rather than, I think years ago it was more a tool for practitioners who would put a lot of information in there that possibly didn't make a lot of sense to families. Now it's, we're encouraging the parents to write in it too, and for them to get other professionals to write in it as well.
That's a really good idea. I've seen the blue ones, now it's green, so it's just like,
yellow, blue and then green, and it certainly looks a lot different to what mine looked like.
I just think that's really cool how it keeps growing and developing, and I think that's fantastic.
There's spots now in it too for parents to put photos, so there's little plastic sleeves that they can put photos in of the child at those ages, or some parents take pictures during the visit and put that photo in the book for them.
That's brilliant.
Yeah.
That's brilliant. How long has there been maternal child health centres in Australia?
So the first centre opened in 1917, and by I think nearly 1950 there was nearly 400 centres around the state. I think probably the service grew out of concerns around infant mortality, but also the feminist movement and women speaking up more about services that they felt that they needed.
What effect has having maternal child health centres had on the health and well-being of children and of mothers?
The research findings into early childhood are quite conclusive that outcomes for children who access and utilise universal health and education services such as maternal and child health are improved. So there's quite an emphatic body of research that says if we invest in the early years and make sure that we do what we can for children at that time, that their outcomes will be much better.
Do you deal with fathers as well as mothers?
Yes, we definitely do see fathers too. So I would say that that's actually happening more and more often as we're finding some stereotypical gender roles are changing a little bit. So some fathers are now the stay-at-home parent. Some couples split, both parents working, having some time working and some time at home caring for children. And even often in families where the father is still the primary working parent, dads will often organise time off to come into the visits just because they like to be involved, which is really lovely to see.
That is so lovely. That's beautiful. Are there any after-hour appointments for working parents?
We don't tend to offer a lot of late appointments routinely, so on occasion a nurse might do that to accommodate a specific request, but we find that generally by late in the day children are tired and they're not always amenable to having a late visit, so it's not always as practical as you would think for parents. To do a lot of the things we need to do, we need children to be cooperating with us, and so for 2-year-olds and 3.5-year-olds who are tired, that can be difficult. So what we tend to do instead is we run a Saturday morning session once a month, and we find that's quite well attended by working parents, and we have the flexibility to be able to extend the time that that session goes for based on need. So if we had a lot of parents interested in appointments, we could just make it a longer day so that they could be seen.
Pretty cool. Are there any frequently asked questions?
I would say that probably most commonly parents ask the most questions about things like sleep, feeding and behaviour. So, for example, how to encourage their children to wake less overnight, concerns about breast or bottle feeding or fussy eating with older children, and behaviour, so things like tantrums and children fighting with siblings and those sorts of things.
Just in regards to that, do you give referrals to things like positive parenting courses, or you have information for that sort of thing at all?
Yes. So at all of the key age and stage visits, information for parents is standardised now across the state in terms of the literature that we hand out, so that we're making sure that it's a consistently high standard, that it's evidence-based and it's appealing to parents and relevant and those things. So at each key age and stage visit, we're provided with a pack of information from the department to give to parents and to discuss with them. And outside of those times, we generally direct them to resources again where we know the information is current and we know that effort's put into updating it. So resources like the Raising Children's Network, the Royal Children's Hospital website, places like that have a lot of really good current information for parents that's really usually quite accessible, quick and easy to read. It's just giving them, the basics of what they need to know. But we certainly can also refer to other professionals. So if a behaviour's, more difficult for families to manage or something like that, then we might refer them to someone for some more in-depth assistance with that.
Let's take another break and we'll come back after these messages from our sponsors, and maybe even a song.